Joining us now is Jerold Mande, a public health professor at Harvard's School of Public Health and also the CEO of Nourish Science. Thank you so much for being here. Merry Christmas. What do you think the guideline changes will be, and what are you looking for?
Well, thank you, Jessica. It's a delight to join you. You're right. The dietary guidelines is really RFK Jr. and MAHA's first really big chance to shift policy. And what we're looking for is changes that would help do that. And they put out a report earlier this year where they were spot on in identifying a food cause, chronic disease in children, as a national problem we need to address. And the best way they could do that in these new dietary guidelines is by focusing on ultra-processed food. Something in that first report they mentioned 44 times as the root cause of the problem, that we need to eat less of that. So hopefully the report will emphasize that.
RFK Jr. has suggested the guidelines would encourage people to eat more meat, full-fat dairy, and saturated fats. Is this a good thing or a bad thing? We've always heard saturated fat, no.
Yeah, no, that would be a mistake if they do that. Okay. Heart attacks are down 90% from where they once were. And primarily it was drugs and less smoking, but saturated fat played a key part of that. We know that diets high in saturated fat result in higher cholesterol levels in your blood, and that results in more cardiovascular disease. And in particular, if we're trying to protect our children, we don't want them to go down that path. We want to make sure we can keep their bodies healthy. And the best way to do that is to follow the current saturated fat recommendations.
A lot of people may say, well, these are just guidelines. They don't really matter. But many institutions use them to inform meals they serve, like daycares, schools, military cafeterias. Is that correct?
Yeah, the most important, it's what the school meals program follows. It's the blueprint that they follow what's in schools. And when I was at the Department of Agriculture, we updated those standards and put in place the healthy meals we have today. In fact, before those were put in place, USDA did a survey. They scored the quality of school meals. It received a 58 out of 100, a failing score. But 3 years later, after the new standards were placed, it was 82, quite a good score. And in fact, for most kids, the healthiest meal they had all day. And that's still the case. And in fact, just recently, they've been updated to remove added sugars, so they're even healthier today.
We've already seen big food companies get hit hard by the MAHA movement, bans on red dye. Is this another gut punch for them?
Well, no, I don't think so. I mean, I think it depends on the changes they make. If the change is, gee, we need to eat less ultra-processed food, I think it just makes it clear for them what the future is going to look like and where they have to go. Americans have the shortest lifespans by a lot. I mentioned our kids are sick, and it's been tied to the change in our food. We used to, our companies used to sell us food. Now they sell us these industrial formulations that really have substituted their profits for our health.
There's also more than a dozen states that plan to restrict junk food, with new bans going into effect next year. So, for example, SNAP benefits in Florida will no longer cover things like soda and candy starting January 1st. Do you expect this trend to continue, and will we be seeing more of these junk food bans or soda tax next year?
Well, I hope so. It's been really the most important step that MAHA has taken in this administration. Has not been with RFK Jr., but actually Brooke Rollins at the Department of Agriculture. When I was there, we were trying to shift the policy from the current federal goal of ensuring access to healthy options to ensuring every child reaches age 18 at a healthy weight and good metabolic health. And SNAP's our biggest program, and it really has a lot of leverage on food companies, and we should use it. But when we were there, I wasn't able to get one state to do that in 6 years. She already has 18 states do it. I think it's the most important step they've taken.
This is a great idea to make America healthy, but how do you tell this to someone who lives in a food desert, right, and doesn't have access to fresh fruits and veggies?
Well, that's right. And that's why, having a goal of ensuring access to healthy options or saying people should eat whole foods, just doesn't work for a lot of people. As you're saying, it depends on where you live, the resources you have. And so the law requires that the food that's sold can be eaten as intended and not make us sick. It was written into the law way back in 1906 when Teddy Roosevelt was president. There was a chemist at USDA, Harvey Wiley, and he created the FDA with the sole purpose of making sure that processed food food, which was new at that time, and the chemical additives didn't make us sick. It's already the law. It's just not being enforced because the food companies use their political power in Congress to restrain the agencies from doing their job. Hopefully RFK Jr. and Brooke Rollins will change that.
Before you go, San Francisco just became the first city to file a lawsuit against 10 major food companies for deceptive marketing of these ultra-processed foods. Do you anticipate that we will see more lawsuits like this?
I do, and it's a really important step. You know, earlier when I worked in government, we regulated tobacco. Much like today, a third of children are sick with a food-caused chronic disease. Back then, a third of young people smoked. Today, the U.S. leads the world. We have the lowest smoking rate in our children, less than 2%. And a big step in helping us make that regulatory change were the lawsuits that states brought against the tobacco company. It hadn't, you know, we were hoping that would start against the food companies earlier. It's taken some time, but I think it's a really important step. I think it really focuses the food companies when it hits them in the pocket like that to make sure that, gee, we really do need to change our practices. And it makes sense states do it. You know, there have been suits on behalf of an individual. It's hard to prove what made them sick. But all of our states, we're all paying higher taxes because of how sick we are, caused for Medicaid, Medicare bills that the food companies have caused and have not been held responsible for.
All right, Jerold Mande, thank you so much. Merry Christmas to you.
You too, Jessica. Thank you so much.
Thank you.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.